Assalamu alaikum wa rahmatullahi wa barakatuh. Hi dear third year medical students, we will talk today about one of the series lecture of nutrition in community medicine, and we will start today with carbohydrate. So it is one of the important subjects. What do we know about carbohydrate? Carbohydrate is one of the components of nutrition, and we have to know that it is an organic compound, and it consists of carbon, hydrogen, and oxygen. Mainly it consists of sugars and starch. They are very rich food in their natural state. They are low in calories and high in fibers. We will talk now about starch. Starch are the least expensive type, and it is obtained easily and readily digested from the form of fuel, and also they considered as a major source of food in many people in the world. The main source of carbohydrate are cereals as breads, pastas and rice, or grains, legumes, lentils and chickpeas, beans and fava beans, fruits and vegetables, sugar as candy, sweets, and sodas and beers, wines. This is, as you remembered, this is the pyramid, and here cereals and breads are of the high fiber category, and it is of most nutrient and healthy type of food. So how we classify carbohydrate? We have the monosaccharide, first, number one. These are the simple sugars, and they have a great and quick energy supply. We have the glucose, fructose, and galactose. These are all monosaccharides. The glucose is other name is dextrose or the grape sugar, and it is simplest form. It's found in the fruit, vegetables, and in honey. While the fructose, it is fruit sugar, and also it is present from the name. So obviously, it is in the fruit and vegetables, and in sugar beet, sugar cane, and honey. Regarding galactose and mannose, they are called the milk sugar. They are found in milk and not free in the food. Sorbitol present in fruit, in apple and peach, and vegetables in dietetic diet. They have the same power of sweetening of glucose, but they are very slowly absorbed. The absorption rate is 1/3 of the absorption rate of the glucose from the intestine, and they have the same calorie, the same sweet power, the same calorie, but the absorption rate is less than that of glucose. It is 1/3 of the glucose, so it will rise the serum glucose but slowly. When it is absorbed, it will be converted in the liver to fructose, and it will supply 2.6 kilocalorie. It causes flatulence and diarrhea in some people, and less likely to cause dental caries than sucrose. So it is better source of sugar. Now we will discuss mannitol. It is found in the pineapples, and this is the pineapples, and in olives, and in carrots, and in dietetic diet. 50% of it is absorbed from the intestine and useful in obesity. It only supplies 1.6 kilocalorie. The xylitol is also another type of sugar. It is only 1/5 rate of absorption of the glucose. It is slowly absorbable type of sugar, and it is used in sugarless chewing gum because the carcinogenic bacteria are unable to use it as a substitute, and it will stimulate saliva secretion, non-fermentable sugar, and has antimicrobial effect. Now we will discuss the disaccharides. It composed of sucrose, which is, as we know, it is a table sugar, and it is composed of 1 atom of glucose and fructose. It's present in cane, in beet sugar, and in molasses. This is the sucrose. And we have the lactose. Also, it is a type of disaccharide. We call it the milk sugar. It's composed of glucose and galactose, found in milk, in dairy product, and not occur in plant food. This is only in milk. In lactose deficient enzyme patient, they got distended abdomen, they got diarrhea and flatulence because of the lactose fermentation by bacteria in the bowel. It will replace by lactose-free milk formula and adding maltose to the milk instead of glucose as a treatment for those patients who have lactose enzyme deficiency, and especially in young children and infants. Maltose is malt sugar. This is the malt sugar. It composed of 2 atoms of glucose, and it found in the malt product. Lactulose is synthetic type. Lactulose is synthetic product, not occur in food and not digested and used as laxative. And we have, as we said, there are 2 products. We have the trehalose. The trehalose is a glucose found in mushroom and in yeast. So you have to remember the disaccharides. The most common type is saccharose, and lactose may have abnormality in some person who have lactose enzyme deficiency and causing disease entity, and should be replaced by maltose type of milk, and maltose found in malt product, and we have lactulose synthetic product, and we have a trehalose which is found in mushroom and yeast. Also, we'll talk about the polysaccharide. Polysaccharide is complex type of carbohydrate, take longer time to be digested and release the glucose to the blood. And they include digestible form and a partially digestible form. Digestible form as starch and glycogen. Starch present in cereals, in breads and rice and oatmeal, whole grains, beans, and the end product is glucose. So starch is present in high amount in many foods, and the end product is glucose. Glycogen is an animal starch. It will be stored in the muscles and the liver and in meat product and seafood, and also the end product is glucose. So this is a digestible form of polysaccharide. We have partially digestible form like inulin, which is present in onion and garlic and mushrooms, and we have galactogenes. Snail, it will form galactose, and the end product here of inulin is fructose, while of galactogene is galactose. And the mannose as legumes, it will end product is mannose, and raffinose as sugar beet, kidney beets, lentils, and this will produce glucose, fructose, galactose respectively. And we have the stachyose as beans, and pentosans as fruits and gums. These are all types of polysaccharides. As we said, there is digestible form, and they are in sugar, the end product, and the partially digestible, they aid in different part of sugar. The digestion is incomplete and need further splitting by bacteria in large bowel, which lead to production of flatus. So we have to remember that partially digestible type of polysaccharide, they causes flatulence, abdominal distension and discomfort. And we have the third type we call the indigestible form. They are the dietary fibers in the plant food. And these substances, they have a great affinity for water and form a bulk. So it will slow the gastric emptying time. And they may have ability to bind to bile acids. They are not digested by the GI tract enzymes and may be divided into soluble and insoluble. Soluble form is pectin and gum, and the insoluble form is cellulose and hemicellulose. The brown cereals are the most concentrated fiber source, providing 6 to 13 gram fibers per serving. What about cellulose? It is present in the leaves of vegetables, the green vegetables, and in the leaf of vegetables and outer covering of seeds. Hemicellulose in leaf of vegetable and outer covering of seeds, it's used as laxative and feeling of satiety after eating. Pectin here is used in fruits and in gums, as in this picture, and jellies. They absorb water to form jelly, a gel-like. And what about gums? This is gums. This is the plant secretion and seeds. Degree of sweetness differ. Sugars differ in their degree of sweetness according to the source. Sucrose degree of sweetness is 100, fructose is 173, glucose is 74, galactose is 32, lactose minus 16. It is tasteless. Sorbitol, mannitol, 50 to 60%, 70% of as sweet as sucrose, and saccharin 200 to 700% as sweet as sucrose, and aspartame 160 to 220% as sweet as sucrose. What's the importance of dietary fiber? First of all, it prevents constipation. How? It acts by normalizing the intestinal transit time, and once the transit time of intestine is normalized, they will increase the fecal bulk. This will decrease the colonic intraluminal pressure and act as substrate for colonic fermentation and also for gas production. It will act to move fecal material through the colon. Without sufficient water, it will lead to dry stool and hemorrhoid, constipation, and so on. What do we mean by transit time? Is the time of contact of food particle to the wall of the colon. So this type of food will normalize the intestinal transit time and forming bulk stool, increase the pressure, and move the stool outside. But we have to emphasize on drinking a lot of water, because absence or decreased amount of water, it will lead to causing constipation, dry stool, and hemorrhoid. What's the role of fiber in the cardiovascular system? It will act by reducing cholesterol when give large amount of soluble fiber by three mechanisms. First of all, they bind to the bile salt and to cholesterol, and then it will prevent reabsorption, so decreases the amount of cholesterol. And number two, they increase the fecal bulk and reduce the exposure of the bile salt to mucosal cell. And third, bacteria in the colon reduce soluble fibers to short chain fatty acid, which block cholesterol synthesis in the liver. So what's the action here? It will decrease the cholesterol by three mechanisms. First of all, it will prevent reabsorption, as it will be bind to the bile salt and cholesterol, and also reduce the exposure of bile salt to mucosal cell, as it will form bulk stool. And also the bacteria, it will reduce bacteria in the colon, and here we have the beneficial bacteria or normal flora of the colon, will reduce the soluble fiber to short chain fatty acid, and when it changes to fatty acid, block cholesterol synthesis in the liver. And this is the pathway, as we said, it will act here on the liver, and in the GIT they form a type of gel. Soluble fiber form a gel which bind some cholesterol in the small intestine and take it outside the body. And here, this is the cholesterol, as you see here, and it will bind to this fiber. This is the fiber, and form a type of gel and discarded out. Rule in diabetic patient: the fiber is important in form of diet to the diabetic patient. The water-soluble fiber play a hypoglycemic role. How? Affecting the glycemic index of food, because they have low glycemic index as a fiber, and delay gastric emptying time, and slow the starch hydrolysis and the glucose absorption, and it will short the intestinal transit time and reduce the glucose absorption, and slow starch hydrolysis and decrease the glucose absorption. These altogether are beneficial in patient with diabetes, whether type 1 or type 2, so we have to advise the patient to take fiber in high amount. A protective rule against colonic carcinoma by decreasing concentration of carcinogen and reducing the transit time and affect production of bile acid. Furthermore, fibers stimulate chewing and increase saliva flow and gastric juice. It is beneficial effect on digestion. Number 6, it is beneficial role in management of obesity by filling the stomach, providing sense of satiety, and delay gastric emptying and slow the rate of digestion and absorption of nutrients, so decreases the possibility of hunger, and it is have a nice effect to decrease obesity. Also, it is a play important role in the prevention of diverticulitis by taking high fiber diet. We have to remember that excessive fiber intake may interfere with the absorption of calcium and zinc, especially in children and elderly, and we have to give additional calcium and zinc when they took a lot of fibers. So the importance of carbohydrate. First of all, it is major source of energy and the cheapest one. Also, it acts as a protein sparing action. It is anti-ketogenic, as when the decrease carbohydrate intake, and this will cause decreased lipolysis. Whenever there is decreased carbohydrate intake, lipolysis occur, and this will increase the free fatty acid production and ketone body formation and acidosis and dehydration. So when you take carbohydrate in good amount, it acts as anti-ketogenic action. And also, it rule in the activity of nervous system. They are the only source of energy for the brain. So it is important as the main source of energy to the brain, and the brain only have the glucose as fuel. They use it only the glucose. Okay, and it's also important of dietary fibers as mentioned before. The lactose affect the growth of bacteria in the colon. It has a laxative effect and synthesis of the vitamin K in large intestine. Also, it increases the absorption of calcium and phosphate. So these are the important part of lactose effect on the bacteria. And the glucuronic acid, which is a metabolite of glucose, also acts in the liver to combine with chemical and bacterial toxin to form a substance that can be excreted outside. And this is important to get rid from toxicity of certain substances. And also the carbohydrate and their derivatives serve as a precursor for production of a nucleic acid and connective tissue matrix and galactoside of the nervous tissue. We have to remember the recommended intake of carbohydrate. Minimum intake is 50 to 100 grams per day is needed, and that's amount needed to meet the glucose need and to prevent ketosis. We have to remember too that the total carbohydrate, 55 to 60% of the total energy intake is from the carbohydrate. Refined sugar should be limited to 5 to 10%. And increase dietary fiber intake, we have to increase it to 25 to 35 grams per day. This is a must. And fiber intake should consist of equal amount of soluble and insoluble fibers. 5 servings of vegetable and fruits and 6 servings of the whole grain and cereals and legumes is important daily. So we have to know what's the relation between carbohydrate and hormone. First of all, insulin hormone. It is secreted by the pancreas and it will act on the glucose and to facilitate the passage of glucose to the body to the cell all over the body, and we have the extra glucose converted by insulin to glycogen. So it acts to facilitate the movement of sugar to the cells as a fuel, and at the same time it will convert the extra glucose to glycogen and stored as glycogen in the body or to adipose tissue. And glucagon, we have to know, is another hormone. It is secreted also by the pancreas, but it has a reverse action of insulin. It will destroy glycogen and fat to increase the amount of glucose production when there is hypoglycemia. Adrenaline, also we call the epinephrine, it is secreted by the adrenal gland. Also, it acts to liberate glucose in emergency cases. The health effect of sugars: the sugar should be consumed in moderate amount, but the overconsumption of sugar lead to nutrient displacement, as it will take the place or the action of other nutrient. The major health problem when we are losing important nutrient and replaced only by a nutrient contain high sugar. Dental caries, also eating concentrated sweets and sticky carbohydrates, support bacterial growth and causing plaque formation and tooth decay. Obesity, because of high calorie of the sugar, and it will be stored later on as glycogen or as fat. Risk of development of diabetes mellitus type 2. There is a strong relationship between obesity and DM, and the hyperactivity and or attention deficit disorder in children whose increased sugar intake. This would possibly cause altered behavior and other nutrient deficiency. Thank you.